and we're looking for a cure. Thought we'd have one by now. But there are things that are preventable. This woman has terminal cancer. Didn't have to come to this. It was due to negligent prison staff. You know that thing where they catch it early and you have a shot, you're going to be okay. They just get you the treatment you need. But then this is Mississippi. Susie Balfour, age 62, filed a lawsuit this week alleging that healthcare providers contracted by the Mississippi prison, where she was incarcerated for decades, withheld her cancer diagnosis and left her to suffer in pain for years. Suit includes multiple healthcare companies and dozens of physicians and nurses for violating her constitutional rights and denying her timely and proper medical care, leaving this cancer that developed in her breast undiagnosed for years until just before her release. I guess at that point, it's on you to deal with, huh? Balfour was serving time behind bars at the Central Mississippi Correctional Facility for 33 years. For at least 10 years during her sentence, the suit alleges healthcare providers named in the suit failed to recognize or outright ignored the presence of suspicious masses in her breast, even though Balfour complained of pain, tenderness, and lumps. Atlanta Black Star with the details. She had infrequent mammogram appointments between 2011 and 2021, in which doctors noted in multiple reports over the years that the calcifications forming in her breast were increasing, but benign, or probably benign. Well, let's pause there, because then I could be a doctor, right? I've not taken one medical school course, but I could guess that I could be a doctor then, right? In Mississippi, contracted by the Bureau of Prisons down there, I qualify. There's more. Probably benign. However, according to Balfour's attorneys, some doctors' billing records indicate doctors were providing services related to malignant neoplasm in breast that suggests they may have already detected cancer. I'd say that's beyond a guess. That's what you would call a hypothesis, right? It's an educated guess, and perhaps more. It wasn't until November 2021 that Balfour received a biopsy. Okay, almost 10 years, which revealed cancer cells. She was not notified until mere days before her release, December 2021, that she had breast cancer, according to the complaint. After her release, Balfour went to another doctor, underwent more exams, which confirmed it. She had stage 4 breast cancer that spread to her lymph nodes, bones, and liver. It is not the diagnosis you want. The suit maintains that the defendants allowed her cancer to progress from stage 1, which was treatable, to stage 4, which is spreading throughout her body and untreatable. Because of the defendant's deliberate indifference, the suit states surgical intervention such as a mastectomy is simply not an option. Balfour's condition is now untreatable, and it is terminal. Let's get to a possible cause of her cancer ailment. Suit states that during Balfour's incarceration, she and other prisoners were required to clean the prison with chemicals known to cause or contribute to causing breast and other cancers without any protective equipment. The suit purports that at least 15 other incarcerated individuals at CMCF have cancer and are not receiving necessary life-saving treatment. Suit seeks compensatory and punitive damages. What about jail time? This is horrific. I don't want to hear about Putin's horrible, disgusting behaviors. You better go down to Mississippi and see about something. Let's give you the response from the prison, only because I have to. I don't know why they would even respond to this. I would shut up. I would just shut up at this point. You're not to be trusted, but it's here. The team got the statement. Spokesperson for Mississippi Department of Corrections told the Mississippi Free Press that the agency doesn't comment on active litigation. The outlet also reached out to the 3 healthcare companies named in the suit who have not returned a comment. Well, I changed my mind. Now I do want you to answer. Okay, because you got the money, right? You want to keep the contract, right? Isn't that what it's all about? Bean counter, right? Because you're only supposed to provide the bare minimum, okay? It's like that cheap baloney. We want to just keep costs down and people get bonuses and all that nonsense for keeping costs down and using free labor. Have we really come that far? Have we come that far? Are we different than other places? Mississippi would be indication one that we're not. Senator, she deserves money. That's the American way. There should be punishment, punitive, I think they call it. This is a cousin of murder, or maybe just outright murder. To me, that's my opinion. She could have been helped, but you see people who are incarcerated as trash, as lower than low, of not deserving of basic care, just basic care, because you want to save money. I'm disgusted, and we know this has been going on, whether a woman's trying to give birth, is pregnant, all kinds of filth in these prisons. And let's not forget that not everybody in prison should be there, and not everybody in prison should be there for that long. And no one in prison should have to deal with these consequences. Not if you're a civilized nation who wants to preach to other people. I've already said too much, Senator. I need for you to take it and get us over the finish line here. I could be wrong, but I'm emotional.
I'm at the church of Sharon Reed right now. The gospel according to Sharon Reed. I mean, I could listen to you in your monologue all day long. You hit all the nails on the head. It is Mississippi. It's bringing a song to mind that was sung by the great, incomparable Nina Simone. Mississippi Goddamn is the title of the song. And she was talking about lynching and black bodies swinging from poplar trees. Well, symbolically, that prison was a tree. This did not have to happen to Miss Balfour, as you laid out, Sharon, just a callous indifference to her life. And the fact that, yeah, not just in Mississippi, but in most prisons in this country, in this industrialized nation, they see people there as throwaway no matter what. And other nations handle imprisonment a lot different than we do. And your point, Miss Sharon Reed, about how we got the pure, unadulterated gall to point our fingers at other nations. You know, there's something in the Christian Bible that says before you start to try to pull the mote out of somebody else's eye, you ought to get it out of yours. We have so many problems and challenges in this country. And it is especially because we purport ourselves to be better, to be of higher order, to be a democracy, to treat our people differently than these other countries that are more autocratic, but and authoritarian. But when it comes down to it, examples like this one just reminds us and reinforces that ultimately we are really not much better than them. So this family, they sentenced this woman to a death sentence. And as the reporting is showing, and thank you, Atlanta Star, again, that others have contracted cancer as well. And then the prison, especially the healthcare providers, they don't want to say nothing. They don't want to say anything because they know that what they did is wrong. My last point, the commodification of healthcare is wrong. And that's what they're doing, whether you're in prison or out of prison, Sharon. They commodify healthcare and they treat us all like we're a bunch of widgets. Because if the insurance company says you can't get that treatment that your doctor say you need, you might not get it anyway.
Senator, this is what scares me and terrifies me. I have chills just listening to you bringing everything together. It's not the dogs at the top in Mississippi, the bean counters, who are implementing the policy. It's that so many people would go along with this. I think I could be wealthy if I were able to escape my own conscience and just go along and get it. I can't do it.
You and me both.
I can't do it. Who are these people? Senator, we would have been fired because Nina and Sharon would have given each other a look. I said, I gotta tell her, I'm not doing this. I
This
probably
ain't
blown the
right.
whistle. I wouldn't have let it go.
That's
Okay.
right.
Now I'm without a job and benefits, but why are there so many people? Am I wrong?
No.
Are they scared? Who would go along with this? Your neighbors. Who would
Yeah.
do this?
Yeah.
It took a whole lot of people
It
to
is.
accomplish this, no?
A whole lot of people. It's an indictment on those individuals and also an indictment on the system itself. The way we use imprison people in this country. You know, that debate about the 13th Amendment, complicated amendment, take free, doing away with chattel slavery in the United States of America. But we know there's a loophole in it when it comes to people who are imprisoned. And we need to deal with that. We really do, Sharon. This is incredibly
Call it
sad.
what it is.
Yeah.
Yeah, I want more. And I know we look to the federal government that's fully flawed in many areas to handle some of this, but I don't want to hear about quiet investigations and this and that. You better get down to Mississippi because there are civil rights. It's a civil rights debacle down there. And it happens to be aimed at people like us. This is Indisputable. We have the Honorable Senator Nina Turner, who is my absolute favorite. I aspire to be her. I just want to be in her presence. That's good enough, right? There's only one Nina, but I can be in her presence, and so can you. You are a freedom fighter who's quite buff with those shoulders. I will get there too. Okay. I told you, don't tell Dr. Richey what goes on when he's not here, okay? He said, do the show the way you want to do it. And so maybe I took a few liberties. I got to stop.